Good morning, good afternoon, or good evening, depending on what time it is that you are watching this. Now, my name is Dr. Kendi Guantai, and I am speaking to you today in my capacity as the president of the Leeds African Communities Network. This is really in response to a rather disturbing message that I received yesterday. Indications are, or rather, this information that I received indicated that the West Yorkshire Police are really concerned about members of the BAME community in Leeds. That's the Black, Asian, and minority ethnic communities in Leeds. Their concerns are around COVID-19 health-related messages that they have found on the ground don't seem to be reaching these communities in the way that they should be. So the first thing that, one of the things that they have talked about is that they noticed a good number of people wanting to pack up their bags and go back to their home countries, travel back home. Now, we know obviously that a lot of countries are on lockdown. We know that travel restrictions are there, and we know that it will be difficult for people to really travel back home. So the question is, why is it that people want to just pack up and go back home? Now, I do not have the answers, but I can infer that a lot of this would be around immigration. People who are here on temporary visas, perhaps visit visas. You came here for a short period of time to visit your family and loved ones, and now suddenly there is a lockdown and you panic. You could panic because your visa is about to expire and you do not want to be an overstayer. We know that that can have dire consequences. Or from a pragmatic perspective, you have stuff back home, you have responsibilities back home, you have a job, maybe you have businesses, you have family, you have other things that you want to do back home, and you think to yourself, well, I don't know how long this is gonna last for, and therefore I'd rather just pack up and leave and go back home. Or it could be that you are here and you had booked travel back home, you are permanently resident in the UK, and you are thinking, I don't want to miss my sister's wedding, I don't want to miss my brother's wedding, I don't want to miss that event, I don't want to miss that holiday, let me just go back home. Now, what we are being told is that that is really unwise. It is not wise for you to be making any travel arrangements or, at this particular time and with what is going on. Now, the assurance that I can give you is around immigration. So if you go to the UKVI website, and I will be using the information on their website because it is important that you only use information from official sites or from trained people. So when it comes to immigration, unless somebody is a qualified immigration lawyer, really I would urge you go straight to the UKVI website and you will find all the information you need. So according to them, they have said that and I'm just reading from their website, if you are in the UK and your leave expires between January 2020 and 30th of March 2020, so whatever visa you are on is due to expire or has expired anytime from January 2020 or 30th of March 2020, there will be an extension given to you on your visa until 31st of May 2020. Now, of course, this is subject to revision and may be impacted, for instance, whether you have had to quarantine yourself and all of those things. So even that 30th of May 2020, 31st of May 2020 may be subject to revision as this continues. We do not know. But so far, that is the information that they have. However, don't sit at home and just assume, oh, well, they said it's going to be extended and therefore I am covered. What they need you to do is to go on their website and get the contact details for the Coronavirus Immigration Team, the CIT, the Coronavirus Immigration Team. If you search that on Google, it will come up, but make sure it is the official site linked to the UKVI website. So when you go on there, there are a series of questions they will ask you about yourself and your immigration status, and they will be able to process you so that you get that extension up to 31st of May 2020. If you are in this country and you need to extend your visa for whatever reason or renew your visa or what, all of that information in terms of what you can do under these circumstances is on the UKVI website. So please do not panic. Don't feel, oh, my mother is here, her visa is due to expire, I don't want her to be an overstayer because she may not be able to come back. Don't worry about it. All of this has been covered. Okay, so that's the first thing. The second thing that they have said, that they have noticed, is hold on a minute, is that people are still gathering in groups, that communities are still gathering in groups. People are still visiting each other. Kids are playing in groups in the park and other public places. In fact, they said that they had received, there was report rather that the council had received a request by an African community, I am not sure which one, for them to perform cleansing rituals in the city of Leeds, just to, during this time. Now, nothing wrong with that. I'm pretty sure that they had their heart in the right place and they were trying to do something to help. However, this would have meant a gathering of many people, and obviously that is an absolute no-no. So I think people don't seem to be understanding what these lockdown measures are and what is required of them. People, this is not a holiday. We are not on holiday, okay? The government has asked us to adhere to these rules and regulations so that we can keep ourselves safe, we can keep our loved ones safe, and then we can keep other people around us safe. To show you the magnitude of what's going on, just yesterday, between yesterday and today, we had 563 reported deaths in the United Kingdom. Of those, 486 were from England. And of the 486 reported in England, 20 of them had no known underlying health conditions. So they were perfectly healthy individuals. Deaths ranged between 13 and 90, I want to say 93, I don't have the actual figures here, but between 13 and about 90. So you can see it is quite a huge range of people. We can no longer go around thinking that we are safe, or don't worry, we are young, we are healthy, and we are okay. If these statistics are anything to go by, nobody is safe. And because nobody is safe, you need to make sure that you're protecting yourself and your loved ones. Remember as well that you may not be showing symptoms, and that does not necessarily mean that you are not a carrier. So you could quite easily infect other people. So what are the guidelines? So the guidelines are, 1, stay at home. Basically, if you remember nothing else, just remember that, stay at home. Before you leave your house, ask yourself, is it important, or how important or critical is it that I leave my house? You could leave your house because you're a key worker, or and therefore you do need to go to work because you cannot do your work at home. That is allowed. You could be going out of your house because you need to access healthcare. That is allowed. You could be going outside your home because you need to go and fetch food and other provisions. That is allowed, but you should definitely limit the number of those, the number of times that you go to the supermarket. Or you could be going out for exercise. We are allowed to go out once a day for a walk, for a run, or to exercise. You could be allowed to go out under those circumstances. Under all other circumstances, stay at home. Do not allow your children to go to the park and play with other children. Do not allow your friends and family to come and visit you. Someone rings you, oh, I am bored at home, can I come to your house? The answer is no. Your kids say, can we go and see auntie so and so? The answer is no. I know this is very difficult for our communities because we are really interdependent. We babysit for each other. We share a lot together, and even down to people praying together and those kind of gatherings. And I know it is really difficult for us to adhere to what is being asked of us. But if you consider the number of people who could lose their lives because of your carelessness, up to and including yourself, then you will rethink. Okay, this is not forever, but if we cooperate, this will go much faster for all of us. Okay, now when you do go out though, on those times that you do go out, remember that you are to be 2 meters away from anybody you meet on the road, anybody in the supermarket, or wherever you are. Maintain a 2 minute, rather a 2 meter radius or 6 foot radius between you and anybody else around you. And remember as well, hand washing. The hand washing regime, I think this has been on telly, it's been everywhere. Hand washing is really important. If you do go out for exercise with your child, inevitably there will be inevitably they will be touching stuff, as you walk around. That is normal. Kids do that. So immediately they come in, make sure you give, they wash their hands, or you give them a proper wash before they start going around and going around in the house. So hand washing is very, very important. Okay, now finally, the question that has come up is, say for instance you get to a point where you're quite unwell, you're an overstayer, or you're not here legally, your immigration status is not proper, so to speak, or maybe you're on a visit visa and would ordinarily not be entitled to NHS free healthcare. What do? What the NHS have said, and again, this is on their website, it says that overseas visitors to England, including anyone living in the UK without permission, will not be charged for testing for coronavirus. Even if the test turns out to be negative, you will not be charged. 2, treatment of COVID-19, you will not be charged. So testing or treatment of COVID-19, you will not be charged. They have gone further to say that no immigration tests are needed if you only have testing or treatment for COVID-19. No immigration tests are needed if you only have testing or treatment for COVID-19. So if it's COVID-19 related, nobody should be asking you what your immigration status is. You have a right to be treated without giving that information, in as long as it is COVID-19. Now, obviously, if it is anything else, so if you go to hospital and you think, I think it might be COVID-19, whatever, and then they start treatment, test for COVID-19 and realize, no, you have something else, it's not COVID-19, then you may be charged for that treatment. But if it is COVID-19, you're in the clear, you're fine. No charge, no immigration checks done on you, okay? So those are 3 things that I would like to emphasize. 1, let us heed to what the government is saying. No gatherings means no gatherings. No visiting friends, no receiving visitors, and no to your children hanging out with their friends in parks and other social areas. 2, no leaving the country to go back to your home country. That definitely, is not encouraged right now. So obviously, if your own country, I know that people are, there are certain countries that are chartering planes or whatever it is they're doing to try and bring their own citizens back home. If it's part of that scheme, then I'm sure your High Commission or your embassy will let you know what it is that you need to do, and you need to follow those guidelines. But outside of that, please do not be making your own plans to travel back home, especially if you're doing it because you think you might be punished as an overstayer, because your visit visa is coming to expire, or your short stay visa, whatever that visa might be, is coming to expire. UKVI has said that they will honor those visas up to 31st of May 2020. But as I said, you need to get in touch with the CIT to make sure that your details are correct and are recorded correctly by the UKVI. And number 3, if you are seeking healthcare, if you are in this country, be it illegally or as a short stayer on a short stay visa of any kind, and you need testing for COVID-19 or treatment for COVID-19, the NHS have clearly stated that you will not be charged for the test, and you will not be charged for treatment, and that there will be no immigration checks done on you. Okay, so I hope you find that information useful. I would say that if you have any more questions, if you have anything that you want us to look out for or to get information for you or to signpost you to, we have a Facebook page, Leeds African Communities Network, LAC, Leeds African Communities, LAC. So please go on there, send us a message or get in touch with any of our members that you might know, and that information will come to us, and we will do our best to make sure that we get you the correct official information that will help you with anything COVID-19 related. There is a lot of misinformation and a lot of fraudulent activity around COVID-19. We need you to be safe, keep yourselves safe, and we will do our best to give you the information that will allow you or help you to keep yourselves safe. Okay, so I will probably come up with a few updates as time goes by and as questions come in and as I receive more information from our different sources and different organizations that we are working with. So do take care of yourselves, take care of your loved ones. Remember, stay at home unless you absolutely have got to leave, and follow the guidelines that are being given because they are for your benefit and the benefits of your loved ones. So thank you very much, and I hopefully will be seeing you soon. Thank you.